Rolling?
Yep.
Okay, all right guys, we wanted to do a quick video on explaining the differences between going and seeing a medical neurologist and a functional neurologist. The differences lie within a little bit of the diagnosis and the treatment, which we'll get to in a bit. But the main thing is we start out the same. If you go see a good medical neurologist or a good functional neurologist, you're first going to have a good, thorough history and workup, examination, and then a diagnosis will be made. The biggest thing that happens with a medical diagnosis is they're looking for pathologies. They're looking for things that are wrong. They want to rule out serious situations, tumors, masses, other growing types of lesions. They want to rule out any sort of blatant pathologies such as multiple sclerosis, or if they can find any sort of findings on equipment to rule out vertigo, like BPPV, benign positional vertigo. The treatment will usually consist of drugs and or surgery, and then at times they'll send you out for any sort of special based rehabilitation, such as seeing vestibular rehab, physical therapy, or some other type of specialty rehab clinic. Going back to the example with BPPV, typically the therapy is going to be protocol driven, and being that no one fits into a textbook, this is where the big differences lie with seeing a functional neurologist. So let's say that same person comes in and they're dealing with BPPV. What we are going to do is rule out, is there a pathology going on? We want to make sure there's nothing serious going on as well. And if there is, then we're going to send you to the right person to make sure it's getting taken care of. Then what we want to do is find the subtleties, because everyone is different, every brain is different. Everyone is going to present with similar symptoms, but it might be slightly different subtleties and nuances that are driving the problem. We want to look at those subtleties and make sure they're addressed. So with someone with BPPV, going back to this, you might be doing an Epley's maneuver, or what they call a barbecue roll, or an anterior canal maneuver to fix things, and that might be the end of it. Where functional neurologists come in is, yeah, we might be doing those maneuvers, but we might customize the maneuvers to your needs, specifically to get faster, better results. Then we might end the treatment plan based on doing extra gaze stability exercises, as an example, to make sure that that system stays stable. And as well, within the treatment plan, we want to make sure that what are called the metabolic needs are met. Sometimes people have anemia, or they have chronic underlying inflammation that doesn't allow the best of results to happen. We want to rule all that out, and we want to address it. And then your treatment plan with that might consist of fixing underlying inflammation, dosing you up on anti-inflammatories such as fish oil or turmeric or vitamin D, and then also addressing any sort of lifestyle changes that need to be done at home and any other nutritional needs. But the big difference is customized treatment plan based on that person's needs that are right in front of us. And that goes for most conditions. Some conditions that we can't help with are tumors and masses in very serious situations. We can, however, help those people after those are taken care of by the medical neurologist. But we can apply all of this to children with autism, children with ADHD, BPPV, people that are dealing with neurodegeneration, post-concussion, stroke rehab. The big thing is that we want to customize the treatment plan, make it to specifically your needs, address any other lifestyle issues in nutrition. That way we can maximize the results.